Can I have eyelid surgery if I have dry eyes?
Many people who suffer from dry eyes can potentially benefit from eyelid surgery to treat under-eye bags, hooded upper eyelids, or eyelid ptosis. At the same time, if you have dry eyes, you may be hesitant about surgery because of potential surgery-related causes which may make dry eyes become worse. In this video, I will explain how I approach patients with dry eyes in my practice and how eyelid surgery can be done for many patients who have dry eyes. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. To be an oculoplastic surgeon, you have to first be trained in ophthalmology. As an oculoplastic surgeon, I have expertise with disorders of the lacrimal system, which includes the lacrimal gland, which produces tears, and the tear duct system, which drains the tears. This background informs all cosmetic surgery I perform in the eye area. It is often the case where a general plastic surgeon performs eyelid surgery and then sends the patient to an ophthalmologist once the patient complains of dry eye symptoms. The plastic surgeon essentially puts the burden of the surgical outcome onto the ophthalmologist, who is now put in the difficult position of having to manage the patient's dry eyes for years, long after the plastic surgeon compromised the eyelid function. A systematic approach to identifying the degree of dry eye prior to surgery is very important. Further, I would add that specific aspects of eyelid anatomy directly affect eyelid function and will impact future dry eye management. For example, lower eyelid surgery for eye bag removal is a very popular procedure. The lower eyelid is very important for proper distribution of tears over the eyes. You can see this interaction of the upper and lower eyelids to be working like a windshield wiper to evenly distribute tears over the surface of the eyes. If there is any change in the anatomy of the lower eyelid, particularly the position of the eyelid margin, this tear distribution function will be impacted. For example, a very commonly performed technique for lower eyelid surgery is the transcutaneous method, where an incision is made below the eyelashes to remove and sculpt the fat which causes eye bags. It is common practice to also remove skin at the same time in an attempt to improve the fine lines and wrinkles under the eyes. Without managing the critical structural support of the lower eyelid, this technique often compromises the position of the lower eyelid as well as its function. The result is a pulled-down appearance frequently referred to as lower eyelid retraction, which can cause an inability for the full closure of the eyes, resulting in eye exposure and dryness. Tear film distribution is also compromised when the eyelids are retracted. For primary lower eyelid surgery for under-eye bags, I evaluate the anatomy and function of the lower eyelid using what's called a pull test and a snapback test. These tests help me decide if any additional support procedures would be appropriate, such as a lateral tarsal strip to position the lower eyelid for optimal tear distribution. My preferred approach to addressing lower eyelid fat pockets is called a transconjunctival lower eyelid blepharoplasty. This means that I address the fat pockets from the inside of the eyelid. This technique better preserves lower eyelid support structures, in particular the support muscle called the orbicularis oculi, and maintain the position of the eyelid margin. This means the tear distribution is properly maintained. I routinely perform this surgery on patients with dry eyes even those with a history of severe dry eyes. Additionally, my patients appreciate that there is no visible external scar and the natural shape of the eyes are maintained. Oftentimes, people who have dry eyes will actually have an improvement in their dry eye symptoms after well-executed eyelid surgery. This is because procedures which improve the tone and position of the lower eyelid combined with the relief of weight from extra skin on the upper eyelid help the eyelids protect and lubricate the eyes better. Eyes that look good function well. When it comes to upper eyelid blepharoplasty, it's critically important to not remove too much skin, particularly in patients with dry eyes. I would also add that with upper eyelid surgery, particular care must be taken to protect a gland which produces tears called the lacrimal gland. The lacrimal gland exists in the same space where the fat pockets in the upper eyelid are present. When the upper eyelids appear full and heavy, both the fat and the lacrimal gland can be responsible for this appearance. It's routine to sculpt and remove some fat to create more space. Unfortunately, it's been well known that the lacrimal gland has been mistakenly removed by general plastic surgeons, which resulted in significant loss of tear production. As an oculoplastic surgeon, during evaluation as well as during surgery, I look for the lacrimal gland, which is often prolapsed or displaced downward. Instead of removing the lacrimal gland, I perform a procedure called lacrimal gland resuspension to restore the anatomical position of the lacrimal gland as well as preserve the function of tear production from the lacrimal gland. It's important to have a clear strategy for dry eye management before and after surgery. It's well established that there may be some short-term decrease in tear production after eyelid surgery. So generally, I advise my dry eye patients to increase the frequency of lubricating eye drop use prior to surgery. Further, I work with my patients to help them with dry eye management after surgery. As far as the anesthesia experience, I perform all my eyelid surgeries with local anesthesia with light sedation. My patients recover comfortably and quickly, so they typically are able to return to work in about 1 week. Cosmetic eyelid surgery can be done safely for people with dry eyes. As mentioned earlier, there are often opportunities to help improve dry eye symptoms with specific procedures which are well known to oculoplastic surgeons. I would state without reservation that a cosmetic eyelid surgery specialist with training in ophthalmology is ideally suited to perform cosmetic eyelid surgery for people with dry eye syndrome. I hope you found this information helpful. Thank you for your question.